like a siren to a scoundrel, I say. Come on, child. And I say, come on, child. Blanket where she hides by virgin lights. Look to the sea where the cotton hits a turnpike, staring at her knees. But I don't have the words right now. If up to me, might make her turn right. Lost another one, but she still smiles. Black love eyes, and steady seats for miles. Says she wants to stay a child now, and wonders why we ever have to die. And I say, come on, child. And I say, come on, child. Just a touch, I'm gonna carry another time where our palms share the same line. The accent of a kiss whispers we're married now. It's either love or just the sun in my eyes. And I say, come on, child. And I say, come on, child. Love, 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 love.
It's up in the morning, it's on dance, and little white clouds like a gambling lambs. And I am breathless over you, and the red-breasted robin beats his wings as a throat it trembles when he sings. For he is helpless before you, and the happy hood bluebells bow and the bend of their heads all down, heavy by the early morning dew, at the whispering stream, at the bubbling brook, the fishes leap up to take a look, for they are breathless over you. Still your hands, still your heart, still your face comes shining through, and all the morning it glows in you. Still your mind, still your soul, for still the fire of love is true, and I am breathless without you. The wind circles among the trees, and it bangs about of the new-made leaves, for it is breathless without you. And the fox chases the rabbit around, and the rabbit hides beneath the ground, for he is defenseless without you. The sky of daytime dies away, and all the earthly things they stop to play, for we are all breathless without you. I listen to my jaw-dropping bones, and the blood in my veins, the wind in my lungs, and I am breathless without you. Still your hands, still your heart, still your face come shining through, your soul, steal your mind, for steal the fire of the love is true, and I am breathless without you.
Nick Cave at the Bad Seeds. Breathless Without You. Rose Mitchell, Baby Please Don't Go, coming up first. And Brun, and Do You Remember?
Only what's good for you.
RNZ News at 1. Good afternoon, I'm Grant Walker. The government's daily coronavirus briefing is
Tēnā koutou katoa. My name's Caroline McElnay and I'm Director of Public Health at the Ministry of Health. I've just got a short prepared statement and then I'm happy to take some questions afterwards. The Ministry of Health is sad to report the country's second death linked to COVID-19. The second death is in a woman in her 90s at Burwood Hospital in Christchurch, and she passed away yesterday. The woman had recently returned a positive test to COVID-19. As we have seen around the world, COVID-19 can be a deadly disease, particularly for elderly people and also those with underlying health issues. Now, New Zealand's first death linked to COVID-19 was on March the 29th on the West Coast in a woman in her 70s with underlying health conditions. And as in that case, the country's thoughts will be with the Christchurch woman's family and loved ones at this time. Understandably, the family will take time to grieve, and we would ask media to please respect their privacy. In this case, we can say that the woman was one of a group of 20 residents transferred from Rosewood Rest Home and Hospital to Burwood Hospital earlier in the week as part of the Canterbury District Health Board's cluster management process. Those residents were relocated to a ward at Burwood to allow them to isolate together in a group bubble. The woman who sadly died had experienced a number of common age-related health conditions prior to her testing positive for COVID-19 this week. Because of the current alert level 4, no family members were able to visit the woman in hospital in recent days and were not able to be present when she passed away. However, hospital staff were able to provide her with comfort and support, and we thank them for that. This latest sad news reinforces the importance of our move to alert level 4 and the measures that we are all taking to limit spread, break the chain of transmission, and prevent deaths. Our health system will continue to do everything that we can to support the fight against COVID-19. Canterbury District Health Board will be able to provide additional information this afternoon relating to the ongoing care and support of the other Rosewood residents and their families. I'd like to now give you an update on our numbers. Today, there are 44 new cases of COVID-19 to report. That's made up of 23 new confirmed cases and 21 new probable cases. At this stage, 14 of the new 44 cases are linked to existing clusters with investigations ongoing. There are now 373 reported cases of COVID-19 which we can confirm have recovered, and that's an increase of 56 on yesterday. We can continue to report that we have more people recovered than new combined cases. The combined total of confirmed and probable cases in New Zealand is 1,283. And just an update on those in hospital. Today there are 16 people in hospital. That includes 4 in ICU, 1 each in Wellington, Waitemata, Counties Manukau and Southern DHBs. 2 of these ICU patients in Southern and Waitemata are in a critical condition. For those cases that we have information on, we are still seeing a strong but declining link to overseas travel at 40% and ongoing links to confirmed cases within New Zealand at 44%. That includes those in clusters that we already know about, with community transmission at about 2%. There are still cases that we continue to investigate, and that's about 14%. There are still 12 significant clusters. Our 3 largest clusters remain the same. Waitemata, which now has 69 cases linked to it, and that's up 5 from yesterday. Bluff, which has 87 cases, and that has not changed since yesterday. And Marist College at 84, which is also no change. Thank you, I'm happy to take questions.
What were the underlying conditions of the illness of the woman who died? You say they were age-related problems. Can you tell us what they were?
I'm unable to give any further details on that. This was an elderly, frail woman.
Is anyone related to that woman or who's been in contact with that woman recently? Are they displaying symptoms or are they a possible case?
So the woman was part of a group from the Rosewood Rest Home, and they are being investigated as a group by Canterbury District Health Board.
Any of the patients at Rosewood who were also within that isolation group as that woman, are any of them also in critical condition?
Not that I'm aware of. There are some who have got symptoms and who have been tested, and they are part of the cluster that's reported for Canterbury, but I'm not aware that any of them are in a critical condition. I haven't been briefed otherwise. I have asked about their condition, and they are symptomatic, but they appear to be well whilst symptomatic.
An uptick in cases today after them consecutively dropping for the last few days, is that significant? Does that mean anything?
Well, I think it just confirms that we can't be too complacent about the numbers that we're seeing. I think we're still generally heading in the right direction, and that is really affirming to see that, but it very much emphasises that we're not out of the woods. We can't be complacent. We would expect to see numbers to go up and down in the immediate short term. What I can say is that the increase that we've seen have been a number of cases that are linked to clusters, and we do expect with our clusters to see a bit of ongoing transmission. Those are particularly happening from events that happened prior to lockdown, but we're seeing some ongoing spread within the households of those people who were affected, and we may continue to see a few more cases in that situation.
There has been
Sorry.
Is there any indication as to how this woman, how the virus came into that rest home?
Well, that's being investigated by Canterbury District Health Board. There are a number of staff and residents that they have tested, and one of the questions that they will be looking for is how the first case came to be infected. So they're currently undergoing that investigation, and we will be able to brief you further on details when we've got further details to give you.
How many staff and residents have been tested at this point?
I don't have the complete number of people who were tested, but bear in mind that a number of these residents are elderly and frail, and so this is where the probable definition comes in, where we may not have been able to test people because it's not a pleasant test, and particularly for older people who may not understand exactly why the test is being done, that they may not have been tested, but because of their close proximity and the group that they've been part of, they have been deemed to be a probable case. So the total of the confirmed and the probable does not necessarily mean that they've all been tested.
There has been a dip of testing numbers at the weekend. With it going into the long Easter weekend, are you expecting much of an impact on those testing numbers?
Well, to date we've seen a continuing increase in our testing numbers, and the figures which I saw for yesterday, and I don't have the exact figure with me today, showed that yesterday we had the highest number of tests performed to date. So we are monitoring the numbers over the weekend. We may see a decline in those figures, but on the whole, our pattern has been increasing number of tests, and that's what we're really encouraged by, that we are seeing a lot of tests. Importantly, despite having those large number of tests, we really are not seeing any significant increase in the cases being reported.
Are all the centres going to remain open though over the Easter weekend, or are some of them going to close?
I don't have the details of the specifics there. It may be that some of those centres are having reduced hours, so people would have to check with their local district health board exactly what the opening hours are.
How many staff at Waikato Hospital have now been tested positive for COVID-19?
I don't have the details of that to hand, but I am aware that there were 2 staff who tested positive yesterday, with some further test results expected.
On that case in the Waikato Hospital, we understand that 2 of the staff were infected after being told to remove PPE. How concerning is that?
I'm not aware of the details there. The Waikato District Health Board is fully investigating the situation there in conjunction with their public health unit. So I'm not aware of any specific details there. I am aware that PPE is available for staff. There is no shortage of PPE, so I don't actually know the details of that.
Would it be a concern if they were infected after they'd been told to remove PPE?
I just don't know the details of that particular situation. I'm sorry.
We've been contacted by staff from Auckland and Christchurch DHB saying they're facing similar issues to Waikato with access to PPE. Is it being rationed?
No, definitely not. PPE is not being rationed. We are aware that there's been some issues with distribution of PPE. The country does have sufficient stocks of PPE, and we've been working closely with DHBs to ensure that distribution chain is moving smoothly. Any healthcare staff who are having issues with PPE should contact their DHB and find out why that's happening. We've been working with the DHBs to get a much better distribution system in place, and we hope to be able to stand up a different system next week, with further details will be made available on that.
Right, but in saying that, what's your advice to hospital staff who are wanting to wear it but are being told to take it off?
I would be surprised if people are being told to take off PPE, but that is something that the hospital staff should be discussing with their DHB.
So what would your advice be if someone, like we've had reports of people being told to take it off, so if they are being told to take it off, what's your advice? What do they do?
We have very clear guidance on our website about the use of PPE and when PPE use is required for healthcare workers. I would suggest that individuals look at that advice as a first point, because that's our clear guidance about when you do need to use PPE. And if people are still concerned that their DHB is giving them different advice, then that's when we would advise them to contact us at the Ministry.
Reports out of Hamilton that there are some people door knocking and leafleting over the Easter weekend, sort of spreading the message of the faith, I suppose. Obviously, that goes against the guidance the government's issued. Do you have a message to people who are actually struggling to probably practice their faithful Easter in a different way this time round?
We recognise that it is a challenge for many people. This is a Easter unlike other Easters, but I really want to re-emphasise the Prime Minister's message that this is a time for us all to get behind the country and stay at home over Easter. And I think I'm aware that many churches have already put in place online coverage of services so that people can still worship in the way that they wish to worship, but still be able to stay at home and follow our guidance.
The emphasis of new cases switches from mainly being connected to overseas travel to mainly being connected to existing cases or sort of being new, clusters springing up seemingly from nowhere. How does that change the way that the government is fighting this thing? Does it change your overall strategy?
No, it doesn't change our strategy at the moment because we're in level 4 lockdown and we're aiming for elimination. But what it does mean for these last 2 weeks, what it means is that we have to be very aggressive at stamping out the new cases that pop up and really understanding why they're popping up and what the circumstances have been there. What we would expect to see in the next 2 weeks is that our new cases will be linked to other cases that we already know about. There will be some household transmission is what we would expect to see. If we see anything outside of that may be telling us that our current restrictions perhaps are not actually being followed, and we need to really be very quick to act from any of our outbreaks, that we don't get further spread, because this is our 2 weeks to really get our level of disease down to an absolute minimum within New Zealand.
A staff member who works on the same ward. A staff member who works on the same ward as the nurses who have contracted COVID-19 in Waikato Hospital has been told to go into work despite the fact that it's the same ward as the people who contracted the virus. Are you sure that enough is being done to stop the spread?
I don't know the details of that particular situation, but I have spoken to the CEO of the District Health Board yesterday, and the infection prevention and control practitioners in the hospital are managing and dealing with that. So I'm confident that the right people are managing the staff and patients in Waikato.
Going back to the testing and the retirement home where the woman who died was from, you said that it's a difficult process for them to be tested. Just to clarify, that's not going to be a barrier for testing them?
Well, I think you have to consider the purpose of testing in these sorts of situations where you have a group of people who have been exposed to COVID-19 and are displaying symptoms that fit COVID-19. In that situation, the benefit of a test is really not going to tell you anything more. The group are being managed as a whole as if they have COVID-19, so they have been isolated and they're being managed appropriately. And my point is that for some elderly patients in that situation, the distress, the extra distress of having a test, which they may not completely understand why they're being tested, that's not something that we need to do, and therefore in this situation we don't need to do it.
Can you just clarify exactly what is so distressing about the test?
Well, I'm talking about this particular group of elderly, frail people who may not be able to fully understand what the nurses are saying to them in terms of explaining why they need a test, that can be distressing for people who don't understand. So in this particular situation, if a number of them have been tested, but there were also a number who weren't tested, and I think that is appropriate in this situation because actually they've been managed as a group who've all been exposed. So we would not expect people to be tested in that situation. But this is a very specific situation. And for most people, it's not that unpleasant a test. I think it's just being very mindful of the needs and vulnerabilities of this particular group.
Tell us about any new cases stemming from the Bluff Wedding cluster.
I'm not sure if I've got the details on that. I think I said that it had increased. What we're seeing, Bluff was no change. Bluff was no change from yesterday. What we have been seeing with Bluff was an event that led to quite a number of cases who were there at the event itself. Quite an explosive event, if you like. It was a social event, and that's where we're seeing quite a number of clusters, not just within New Zealand, but it's being observed across the world, that social occasions act as a very efficient vector for spread of disease. But what we're seeing with the recent cases linked to the Bluff wedding is these are cases occurring in the households of people who were at the event. So it's the next generation, but it's been very contained because it's been in those households. And I think it's also a good opportunity to say that had we not been in level 4 lockdown, we would have expected more cases as a result of those individuals who had been at the wedding returning back to their normal places of work or being out in the community. This is exactly the reasons why a level 4 lockdown allows us to really limit the interactions that people have, and so it helps contain, very strongly contains our clusters.
Sorry, there's a significant cluster in Auckland that's just been labelled as workplace. Can you give us any more details around what that might be?
I'm not sure I've got the details of that to hand, sorry.
Confident, going back to the Bluff wedding, that contact tracing will be able to identify everyone who may have been exposed at that wedding, or is it too big of an event?
It has been a big event, but it's also an event like this that we have a ability to coordinate our public health units across the country and connect up cases who appear across the country. And that's what we're seeing with Bluff, is that although it's labelled as Bluff, quite a number of those cases actually live in other parts of the country, and it's through our systems that we're able to connect them, and so we've attributed them to Bluff, but actually many of the cases are in other parts of the country, and we are seeing just a small increase in the case numbers, but just repeat, no increase from yesterday, and certainly Bluff is one that we would expect to see would very quickly be contained with no further increases. I'll just take one last question.
You said before about the critical patients. There were, one of those was that 7 DHB. Is there a link there between the Bluff wedding and that critical patient in ICU?
I'm not aware of any link there, no.
Any update on ventilators overseas coming in?
I haven't got an update on that. Bearing in mind we do have we have quite a substantial number of ventilators already in New Zealand. I'm aware that there were orders being placed to be able to bring more into the country, but I'm not able to update you on the specifics of that order.
Like a little bit of clarification before we finish this up. 14 of today's new cases are linked to existing clusters. So what are the origins of the others?
Oh, I don't have the details here, but with the cases that we received in overnight, what we would expect to see is that more and more of our new cases we can actually link to known clusters and other cases. Okay,
community
thank you.
outbreak 2%?
Yes, it is 2%. Thank you.